Hi and welcome to another video from the CTAD Clinic. My name's Dr. Mike Lloyd and I'm the Clinic Director. In the video today I'm going to be having a quick look at the nature of alters in therapy. Now this is specifically related to conditions such as Other Specified Dissociative Disorder or Dissociative Identity Disorder, known as OSDD and DID respectively, just to make it a bit easier to describe. And within OSD and DID, really what we see is a sort of fragmented pattern of internal experience related to often childhood trauma. And what can take place is that this internal system is characterized by a series of different parts or elements of the individual known as parts or others or alters, or whatever it might be. So I'm going to use alters for the purpose of this video because that's quite sort of common usage language within OSDD and DID circles. And the question really is looking at whether or not alters are required to be present during therapy for conditions such as OSDD and DID. And I suppose I'm really interested in this question because I hear quite a bit from patients that have come into our clinic, but also just some sort of comments and things that are just discussed around the place. For example, in the YouTube channel comments, and some people say that they've had therapy with therapists who have stated that they're sort of like specialized or experts working with dissociation, who state that they do not want to work with alters in therapy, that you shouldn't do it. Presumably for some reasons along the lines of, if you kind of want to encourage participation from alters within therapy, you're sort of encouraging more dissociation, which is the opposite of what therapy should be about, which is to stop the person being dissociative. So their standpoint is, don't work with alters. I'm not having anything to do with it. If alters come out, I'm not interested. I don't really understand that perspective, so I would really need to have conversations with those therapists to figure out what it is that they're coming at, because I don't really know. But in our service, in our clinic, within the CTAD Clinic, that's not how we work at all. We are very welcoming, very open to any alters who want to participate, to be actively involved in the therapeutic process, but absolutely by no means do we say you have to be involved. So we start from a point of view of saying that any person who comes into our service who's got OSDD or DID, if their alters want to join in and participate, they're welcome to do so. And if they don't, then they don't have to. That's fine. And what I'm going to look at in the video today is really a couple of points around this to sort of think about. Firstly, is it necessary for parts to be in therapy? And what happens if they just don't attend therapy whatsoever? And then if they do participate, but not all do participate, what can happen? So, do you need all of them participating? What happens if none of them participate, or a bit of a mixed bag? Some do and some don't. So we'll have a bit of a look at that in the video. The first question to answer then realistically is, do alters have to be part of therapy? So if you've got a condition of OSDD where it is internal experience, do you need direct communication with alters within that system somehow? I.e., do they need to be sort of like talking to the host or the main person who's fronting at that time, and then that be transferred to the therapist to sort of work in that almost like a translator type capacity? One says and it gets narrated across to me. I then reply, goes inside, and it sort of comes through like a triangulated route. You don't. It's not necessary for that to happen. And in the same way as with DID, it's not necessary for parts to front, to switch forward, and to be present and directly communicating with the therapist. I've done many pieces of clinical work with folks with DID, for example, where I rarely get to see alters actively coming into the session. I know they're present, they're behind the scenes, they're listening, they're watching, and sometimes there's commentary on what's going on in therapy, but there's a kind of a rare active involvement within the session. It happens from time to time. Often a sort of a triggered conversation or a memory or something might happen in the session, and kind of boom, there they are. And it's like, oh, hi, great, here we are. And then we do a piece of work. But there's no sense that they have to be there. Like, the therapy is extremely successful without those parts being actively involved in the therapeutic process. And it might be that they're happy to sit behind the scenes and just watch what's going on, or they really don't want to know and they're like, you know what, not interested, therapy's not for me, I'm not attending, and they don't show up. And that's absolutely fine. The only thing that I suppose I'm interested in is that they don't actively stop the person from coming to therapy. Now, we know that they can. Parts have an enormous influence, either through OSDD or by influencing and stopping things or starting things from happening, or by DID from coming in and actually changing the physical behavior. So I'm aware that some parts in the system, if they really wanted to, could prevent the person from the body, if you like, from attending therapy. The fact that they don't do that, to me, is the good sign, and then we work along the way. So we've sort of got implicit consent for therapy to take place because they're not actively stopping it from happening. So I work with whoever shows up, we do the therapeutic work, but we acknowledge the presence of the alters. So even if the alters are not turning up, because they don't have to, it's not that they're being ignored, it's not that we're working without them. They are actively part of the conversation that's taking place within therapy, even if they're not present to do so. I generally think, and the same goes for the folks in my team, that whoever you're communicating with, that message can follow through the deeper layers of consciousness and be heard, maybe at different times, but it certainly can be heard. So even alters that are not present in therapy have an awareness about what's going on, that therapy is happening, and that they have then some degree of participation behind the scenes. So what we do then is we simply set the person up, whoever is attending at the front, to engage in different tasks about negotiating, compromising, collaboration, different sorts of communication, behavioral experiments, whatever it might be that's being done in therapy, to build the structure and stability of that dissociative system in a way that then is much more functional for the ongoing trauma processing that takes place. So parts don't have to be present for that because they're often doing the work behind the scenes. So the person who attends therapy, they get all of the stuff that they need. They go back to their lives outside of that brief moment of therapy, and they do a load of work behind the scenes. They come back into the next therapy session and we talk about what's gone on, what's worked well, what hasn't, who's been involved, who hasn't, and the person just gives the sort of the narrative about everything that's taken place in between those therapy sessions, if it's say once a week, for example. So a lot of work gets done with the alters. They're simply not coming into therapy to do that directly, and that is absolutely fine. Have no problem with that at all, as long as there is progression. I suppose the difficulty is if the person takes all the stuff out of therapy, goes back, and then it gets derailed completely by the alters within the system, who are actively, if you like, sort of sabotaging the therapeutic process, nearly always for protective reasons, but nevertheless it can derail the process. We then have to do separate pieces of work to understand that, but that still doesn't require the alters to be fully present in the therapy room or on the Zoom call, whatever it might be, every single time. Simply not necessary. The second question then was about what happens if some alters attend and some alters don't, what's going on with that? And actually, again, I suppose the answer is it's completely fine. There's many reasons why alters would not want to participate. They might not trust the therapist. They might be kind of actively hostile towards the therapist. They may just be frightened. They don't trust that they're going to be safe within therapy. Or they just want more time really to understand what's going on. Or they might just be the sort of parts that just kind of camp out and hide and do their own thing and do not engage with the outside world in any way. So whether it's OSDD or DID, they will have their own reasons for engagement or not. The parts that do show up, i.e. the ones that are talking through the system with OSDD or actively coming out to be present in therapy, we directly work with those. There may be times when it might not be appropriate to work with those, and we may say, great that you're here. Maybe now isn't the right time, for example, because of the nature of whatever we're working on in that moment or in that particular therapy session. But hey, great that you're here. Spend a few minutes, do something, and then we maybe see you next week. So we don't dismiss parts, but we get into conversations about the appropriateness of certain parts being there for any given reason at any given time. So we work with the ones who are present, we acknowledge the ones who are not present, and we seek to try and understand the deeper reasons why they might not be present. In my experience, the ones that aren't present nearly always start being participatory at some point during the process, even if it's to say, this is a load of rubbish and I don't want to be doing it, then that's absolutely fine. They're exercising their right to do so. And in respecting and acknowledging and just allowing that choice to be made, it starts developing a trusting relationship. So to conclude, realistically speaking, it's massively important that they are aware that therapy is taking place, but it's not massively important that they actively engage in therapy. Somebody has to. The only problem is if no one in the system wants to attend therapy, and like me, you're booking appointments and no one is showing up, that's obviously going to go absolutely nowhere. Sometimes people come to therapy and it's the parts kind of clamp down and they're quiet and not much gets discussed, and that's absolutely fine. Other times parts come to therapy and they're chat, and that's absolutely fine. We work with sort of any combination of participation as long as the person comes into that space. We never trick or coerce or force or say you have to do these things for pretty much anything in terms of attendance. Boundaries and rules about safe practice therapy, all of that stuff has to be kept in place, and that sort of like that is an absolute. But attendance and participation are subject to change, and we know that they do change. So even parts or alters who start by saying they don't want to attend, after a certain number of months or possibly certain years, it's found that actually they're often the ones that are attending and participating and being most useful in the therapeutic progression of that person's journey through recovery. So it's always a wait and see thing. And the flexibility and the ability to just sort of allow the process to sort of play itself out however it best suits the internal system, to let the internal alters have as much choice as possible about attendance or not. And we go with that, we work with that, we seek to understand it, we have conversations about whether you do or whether you don't. It's all available for discussion, and I think that's what makes the longer term therapies really interesting and really productive, because it allows this space for choice and agency to take place, which I believe are fundamentally important processes for a person, especially if they've had childhood trauma where agency and choice have not been given to them. Therapy absolutely should be about providing those choices. So I hope that's been a useful video. Again, as with all things, really look forward to hearing the comments about the video afterwards. And keep throwing us topics for talking about things on this channel, because it's always lovely to get ideas from people, and that's wonderful. So thanks ever so much for taking part, watching and contributing in the comment section. And between now and the next video, as always, please do take great care.